Hello. It's nice to see you again. My name is Brian Cook, and I'm going to tell you a little about non-steroidal anti-inflammatory drugs. The acronym used to describe those is actually NSAIDs. NSAIDs are the most commonly used and most frequently prescribed drugs. Now, they're used for both chronic and acute pain. Chronic being those over 6 months, acute being those very recent, under 6 months. So what kind of pain are you dealing with? Is it chronic? Is it acute? Well, NSAIDs can be used, like I said, to treat both of them, but there are certain things I must tell you about NSAIDs first. Anti-inflammatory drugs, also another word used to describe these. Although it's clear that NSAIDs reduce pain and inflammation, it's not clear whether they decrease the healing time to allow a quicker return to play or return to action, activities of daily living, whatever you would like to describe that. Well, this is the case because there are short-term benefits, but an increase in the amount of inflammation that will happen throughout that process. You see, inflammation can be split up into 9 squares, and some people who have taken such classes as Prevention and Care with Dr. Gerald would know all about this. But let me explain it to you briefly. Inflammation is a process, and like any process, there's a beginning and an end. Well, in taking NSAIDs, non-steroidal anti-inflammatory drugs, because you have that anti-inflammation in there, it is actually prolonging that process. Now, the short-term benefits are that you decrease pain and inflammation at the time, but the process is going to be lengthened out. So the long term, there may be some problems if they're not dealt with. Well, those are the short term and long term. Adverse effects, you may ask about those. Excuse me. When you're watching a TV show, they'll probably slip those in at the bottom. I'm actually going to say it slowly so you understand what I'm saying. The adverse effects of NSAIDs are commonly gastrointestinal, GI, irritation, heartburn, nausea, upper GI bleeding, ulcer-related complications such as perforation, bleeding, obstruction, and even death. Death is very underestimated, and what I mean by that is the people who underestimate the effects of these non-steroidal anti-inflammatory drugs could lead to their demise. There's also greater than 100,000 men and women, maybe even children, that are induced into hospitals because of their underestimation of the drug. Well, the risks are even greater when those people are over 60 years of age, if they already have peptic ulcers in their family history, and especially if the patients are using corticosteroids, anticoagulants, if they're frequent to alcohol or cigarettes. Well, I would leave you, after telling you all about these drugs, I would leave you with this one thing. If you are going to take them with at least a cup of water, maybe even some food. If you're fixing to do an activity, might I recommend some glycogen, aka some carbs. And that way you can get some energy and help along the process for your short-term benefit of taking your non-steroidal anti-inflammatory drugs. And that, my friends, is a public service announcement. I hope you have a wonderful day, and I hope you enjoy your time. Dr. Gerald.